Okay, this is from my book, John McDougall, The Doctor Who Fought for You, and we're going to summarize one of Dr. McDougall's books, his best book, Starch Solution. Okay, and it starts out with a quote by Dr. McDougall: "Starch has unlocked the door to good health for thousands of my patients." So also what Dr. McDougall had said is patients ask him, is there any hope for their health? Will they ever get better from their medical problems? And he says, starch is the solution to your health problems. It's the answer. McDougall tells patients, if you don't know what else to do and you're sick and you want to get better, the first thing you should do is eat 90% of your calories from starch, 5% from fruits, 5% from vegetables. Just do that. And while you're doing that, you're going to keep on getting better. And in the meantime, you can start reading about all the other details. But that's the most important thing. And I actually think that's his biggest contribution to health, was the recognition that if you just feed a population 90% of the calories from starch, almost all the chronic diseases get optimized. Okay, there's more to it than that, of course, but that's the most important thing. And that's a big thing to learn. That's the most valuable thing I've ever learned in my experience of being a doctor for over 30 years. Okay, so Dr. McDougall, after he did his internal medicine internship in Hawaii, he worked in the plantations, taking care of the plantation patients, and also a little bit with the city population, so he got to compare the two. He noticed the sugar plantation workers tended to stay slim, active, free of disease into their 90s. He noticed that the people eating starch-based diets had no diabetes, no coronary artery disease, very little breast cancer, prostate cancer, or colon cancer. He noticed that with Asian populations, like Chinese, Japanese, Korean, Philippines, emigrating to the USA, the grandparents were usually thin and healthy, the children a little fatter, and then the grandchildren much fatter and sicker because of the SAD diet, Standard American Diet. McDougall recalled that nutrition had almost never been mentioned in med school, in his medical textbooks or in residency. But it was in Hawaii that he got this most valuable insight, by being able to compare these different populations. When people adopted a plant-based diet, starch-based diet, they routinely were able to improve their body weight, to come off many pills, and were less likely to need surgeries. So he said, I went to the medical library in Hawaii and saw study after study that described weight loss, relief of chest pain, headaches, arthritis owing to a simple solution: a diet based on starch, supplemented by fruits and vegetables, no pills or surgery needed. Healthy populations get most of their calories from starch. In fact, all long-term healthy populations get most of their calories from starch. There are no exceptions. The same truth dates back throughout recorded human history. The Asians ate rice. The Okinawans also ate sweet potatoes. The Mayans and the Aztecs were known as the people of the corn. The Incas and the South America populations ate potatoes and quinoa. The ancient Egyptians ate wheat. Okay, so it works. Okay, here's the book, the cover of the book, The Starch Solution. And again, the Starch Solution is the answer to people's health problems. Americans and other Western populations, they all have the same disease. We talked about this before. I don't even need to look in the chart. You just say, patient from 55 to 85. I just automatically know. Patient's overweight, they're pre-diabetic or diabetic, they're hypertensive, they've got coronary artery disease, they're impotent, they probably are working towards poor dentition by the time they're cognitively impaired, okay, and they probably got a cataract, or not, maybe hasn't been surgerized yet, but will be soon. It's all the same, they quite often got GERD, okay, they quite often got gallstones, they got a fatty liver. All right, so let's continue here. That's his best book, one of the best nutrition health books ever written. I actually made up this little rhyme here. Starch is what you do. Epidemiology is how you know it's true. Because you'll hear the paleo, keto, carnivore guys try to say, oh, epidemiology is not useful, it's bogus. They say that because it proves they're wrong, okay? 1 billion out of 1 billion rice eaters all being skinny and healthy, that's very good information, all right? All these low-fat, starch-based populations, they're skinny with hardly any of this Western disease type stuff. Okay, if a person eats a starch-based, whole food, vegan diet, they almost certainly will be thin with no type 2 diabetes, have a good blood pressure, clean coronaries, and will have a relatively low risk of cancer and a very low risk of autoimmune disease. McDougall figured that out, and that's the most important thing you could know about health. I can tell you what the internal medicine doctor said to me. Internal medicine doctor said to me, gee, Pete, all this stuff you study, that Dr. McDougall stuff, he goes, you're right. That's kind of like the key to everything. Almost everything, all these patients, they're all fat and sick, diabetes, hypertensive, autoimmune disease, all this stuff. And what's the best treatment? This low-fat vegan diet. And then the funny thing is, none of them want to do it. That's sort of where it's at. Okay, look at my teeth. My kid yelled at me and said I got to brush my teeth. All right, starch is low caloric density. because it stretches the stomach. It's like a big polymer of glucose and wrapped in fiber, and the fiber having to be peeled off slows down the absorption of the glucose. So you get the slow, delayed effect of the glucose is slowly absorbed from the gut to the blood, and that keeps your blood glucose levels in a relatively normal range a prolonged amount of time. So here's the blood glucose curve. After eating, blood sugar goes up a little bit, stays relatively normal, just a little bit elevated a prolonged amount of time. Hunger satisfied with the fewest number of calories, so your body weight's optimized. With simple sugars, you tend to spike your blood glucose too high. Pancreas overcompensates, drives it down quickly. You get rebound hypoglycemia. So then you feel lousy from the hypoglycemia, so you eat some sweets, goes right up again. And so you end up with a roller coaster blood glucose curve. So simple sugars cause weight gain for that reason. Plus, they cause a dysphoria. They make you feel lousy, and you often, sometimes behave badly if you're hypoglycemic. You can be impulsive. It's like being stressed out. And the fat causes other problems. Makes your red blood cells stick together, drops your oxygenation, causes insulin resistance, and it leads to a prolonged elevated blood glucose. It's not good. That's called prediabetes, diabetes. Okay. So Dr. McDougall says starch is the best food to satisfy hunger. It satisfies hunger better than fruits do. He continues, starch should be our primary source of digestible carbohydrate. Digestion of starches is a slow process that gradually releases the sugars from starch, which then goes from the intestine to the blood. Fruits offer a quick burning energy, mostly in the form of simple sugars, but little of a slow burning, sustaining starch. As a result, fruits alone won't satisfy our appetites for very long. The fruits are good for athletes. Ruth Hydrus used to love fruits before competitions. Okay, getting back to Dr. McDougall. Ruth Hydrus, by the way, the multi-decades survivor of metastatic breast cancer, she was Dr. McDougall's patient. He's the one who convinced her to become a low-fat vegan. Okay, Dr. McDougall continues, we humans are built to thrive on starch. The more starch we consume, the healthier we become. Starches include rice, corn, potatoes, sweet potatoes, beans, peas, barley, millet, oats, rye, sorghum, wheat, squash. If you take just one message from this book, it should be eat more starch. Humans are starchivores. So that's a big statement by Dr. McDougall. Humans are starchivores. The most important thing you can do is eat more starch. That's making it as simple as it gets. Okay, if you eat simple sugars, we talked about that, you have a tendency to get rebound hypoglycemia, end up with a roller coaster blood glucose curve. So Dr. McDougall continues, 75% of disease in industrialized countries is chronic dietary problems like obesity, hypertension, coronary artery disease, diabetes, arthritis, and cancer. What do these people have in common? A diet dominated by meat, dairy, fat, and processed foods. For a disease to progress, injury must outpace healing. But for healing to occur, the healing must outpace injury. If the injury goes on too long, it will eventually do irreversible damage. The body is always trying to heal. It does not stop, not even for 1 second. During my years in Hawaii, a young man mangled by a motorcycle accident had many broken ribs, a skull fracture, a left thigh with a comminuted open fracture. Comminuted means broken into multiple parts. Open fracture and numerous superficial lacerations. That's real difficult to fix, a comminuted fracture, because it's broken into all these different parts. It's hard to stabilize it, like with an intermedullary rod and whatnot. Within a week, he was walking with crutches. After 3 months, he was walking on his own without a limp. If a body can heal from this massive assault, then it can heal from almost anything. Yeah, so the body wants to heal, just get out of its way. And that was a good quote. If you want to get the cure, you've got to stop the cause. Okay? McDougall continues, if we eat natural plant foods, we will always, during all stages of life, get enough DHA and other omega-3 fats. So he's saying you'll get your omega-3s just from eating low-fat plant foods. You don't need to go chasing them in any other way. I think that's good advice. Fish do not make omega-3 fats. The fish get the omega-3 fats from plants. It's the algae and the seaweed that makes the omega-3s. A fat is a fat is a fat. Serial angiograms of human heart arteries over a year of studies showed that all 3 types of fat, saturated fat from animals, MUFA, monounsaturated fatty acids from olive oil, and PUFAs, polyunsaturated fatty acids, omega-3s and omega-6 oils, were all associated with significant increases in atherosclerotic lesions. Decreasing total fat intake was the only way to stop the atherosclerotic lesions from growing. And one of the most important predictors of a heart attack risk is the elevated level of factor VII, a substance that enables blood clotting. So I remember all fats causing atherosclerosis. I think that was the David Blankenthorne paper. I remember that. Okay, here's one other reference, Larson, about effects of dietary fat causing elevated clotting factor number 7. Yeah, you're not going to win by fat. Fat's not the friend of the arteries. Olive oil increases blood clotting activity by increasing clotting factor 7 as much as animal fats do. Vegetable oils also impair circulation, resulting in a 20% reduction in blood oxygen, arterial PO2. Reduced oxygen circulation can lead to angina, chest pain, impaired brain function, and fatigue. That's Dr. Mcdougall from Starch Solution, pages 135 to 136. Oh, here's one reference by Peter Quo. He's a cardiologist from Pennsylvania in the 1950s. The effect of lipemia upon coronary and peripheral arterial circulation in patients with essential hyperlipemia. So that's the one where they were 15 to 20% drop in arterial PO2 after eating a high-fat meal because the red blood cells are all sludged together. It'll sludge together from the chylomicrons and from the LDL cholesterol, which is just, the fat in the blood after eating. Nuts and seeds have about 80% of calories from fat. Soy has about 40% of calories from fat. Grains and legumes have about 3 to 10% of calories from fat. So basically, if you eat the high-fat foods, the higher the percentage of calories from fat, the more likely you are to get fat. I would also add, soy has some estrogenic effects. Soy can change a woman's menstrual cycle. Endometrial ablation by heating or cooling is a procedure that stops menstruation. Okay, soy protein increases insulin-like growth factor. Now, this is Dr. McDougall talking. Dr. McDougall has written a lot of things criticizing the problems with soy. He's a little more tactful when he speaks in meetings and stuff, but if you look it up in the book, you will see this. Soy protein increases insulin-like growth factor more than does cow protein. Soy isolated protein increases insulin-like growth factor 1 almost twice as much as cow milk protein. Milk concentrate about 36% increase in ILGF, insulin-like growth factor, versus soy concentrate increases at 69% in insulin-like growth factor. Insulin-like growth factor is associated with increased risk of cancer. Okay, reference is Journal of Clinical Endocrinology, and the concern is that something that elevates insulin-like growth factor might increase cancer risk. Okay, Dr. McDougall continues. It's okay to eat small amounts of minimally processed soy, like 2 ounces or less, but it is not a health food. Okay, and that's from his video where it says Dr. McDougall disputes major medical treatments, osteoporosis, and the broken bone business. So I think that's important that he's pointing it out pretty clear. Soy is, he thinks, not a good food, and at the most you could eat 2 ounces before he's concerned that it might cause you health problems. I think it's just best to avoid soy altogether. It's like one of the most overrated foods there is. You go back and read the non-industry papers and you'll see. Fat is the real culprit in weight gain and causing illness. Salt and sugar are the scapegoats of the Western diet. So McDougall's thinking a little bit here like Nathan Pritikin. Nathan Pritikin said fat is bad. McDougall had said Nathan Pritikin was his most important mentor. Fat is the real culprit. McDougall said fat is the number 1 toxin in the Western diet. There's way too much fat. And he felt salt and sugar were not that big of a deal. Let people put a little salt and sugar on the food, otherwise they won't eat the plant foods. That was his take on it. Okay, McDougall continues. The Eskimo diet is 50% fat, 35% protein, 15% carbohydrate. The Western diet's about 40% fat, 20% protein, and 40% carbohydrate. McDougall diet is 8% fat, so less than 10% fat, 12% protein, and 80% carbohydrate. So he's getting fat down pretty low, below 10%. That's pretty similar to what the Esselstyn diet is. Okay, the Kempner diet is about 5% fat. Actually, the McDougall diet and the Esselstyn diet are very similar. Esselstyn over the last couple of years has added the real sick patients with a lot of baseline coronary artery disease should chew greens, much of the day. Other than that, him and McDougall are very similar, almost exactly the same. Esselstyn doesn't allow nuts or caffeine. Kempner diet is 5% fat, 5% protein, and 90% carbohydrate. I've seen other versions of the Kempner diet written as like 2% fat and 4% protein, but let's just go with this. This is pretty easy. 5% fat, 5% protein, and 90% carbohydrate. And he had the best results, incredibly good results for weight loss, reversal of type 2 diabetes, optimization and successful treatment of hypertension. Okay, here's a reference for Dr. McDougall's newsletter about the Eskimos. Okay, McDougall says, you got to let people put a little salt and sugar on their plant foods or most won't eat them. Dietary sugar does not cause type 2 diabetes. Okay, Dr. McDougall does say that excess consumption of simple sugars can lead to elevated blood triglycerides. So you can get elevated blood triglycerides if you eat too much simple sugars. And that's associated with increased risk of heart attack and stroke. Yeah, so elevated triglycerides is a big deal. A mussel is a mussel is a mussel. Because many fish are high on the food chain, they are highly contaminated. This is McDougall talking. They are highly contaminated with environmental chemicals. High content of mercury. Fish is high in fat, often 60% of the calories from fat, and that contributes to obesity. You look at your so-called salmon. Salmon's 50-50 food. 50% protein and 50% fat. There's no carbohydrate in meat other than like in milk. Okay, McDougall continues. There is considerable evidence that fish fat, omega-3s, will increase a person's risk of cancer and will also increase the risk of metastasis. Yeah, it causes immune suppression. So he's not a fan of this big push to sell omega-3s. Okay, McDougall continues. Fish fat is known to paralyze the actions of insulin and to increase the tendency for diabetes. It causes insulin resistance. It increases the risk of diabetes and to suppress the immune system. Even when fish oil is purified of cholesterol, the omega-3 fat itself will cause LDL bad cholesterol to rise. Fish oil treatment does not promote favorable changes in the diameter of atherosclerotic coronary arteries. So what he's basically saying is you don't need to take fish oil supplements. That's the opinion of Dr. McDougall. And that's it for our brief summary of his great book, The Starch Solution. Hope that was helpful.